Welcome to The Rounds. I'm here today with Dr. Shaquita Bell, Medical Director of the Center for Diversity and Health Equity here at Seattle Children's. We're here today to talk about our key work in reducing health disparities and inequities in our kids. Thanks for being here.
Yeah, thanks for having me.
So one of our values, core values, is equity. We want every kid to have the chance to live their healthiest, most fulfilling life possible. But we know the reality is that not every kid has an equal chance at living a healthy life. What are some of the challenges that some of our populations face?
Great question. So we know in medicine that a lot of people have difficulty accessing care and sometimes even have different outcomes in their health. And we can relate those directly to their race, their ethnicity, and their income. And we notice that certain populations have harder times being healthy, and unfortunately, a lot of that is linked purely to where they come from or what their lives are like. And so one of the great things about working at Children's is that no matter what a patient's insurance is or their ability to pay, they can come here and receive care and do that in an equitable way.
So equity is really giving each kid their individual chance to live their healthiest life.
You have to remember that every child is different and they all have their unique gifts, and we have to tailor our care to each patient so that they can be as healthy as they can be.
As Seattle Children's, what can we do to help reduce the inequities for kids?
I think we're doing really great work here already. I think the Center for Diversity and Health Equity really wants to help continuing support work at Children's to look at how we can help an entire community, an entire family. We have two major programs to help families who may have different language or race or ethnicity from their providers. One is our interpretation services. So whenever a family comes here who does not speak English, we provide an interpreter for them. And what we really strive to do is make sure that the family has two-way communication at all time with their nurses, with their doctors, with anybody providing health care. And then the second program is our cultural navigation program, which is really unique and really special. That program partners with the family and has one individual person, which we call a cultural navigator, who speaks their language and can also interpret some of the culturally specific things to care. So perhaps there is a way in which we do things here or a language that we use that is not necessarily interpretable. It's not a matter of taking it from English to another language, but it's really a cultural difference. And that person acts kind of as a bridge to kind of help us understand where the family's coming from and the family to understand where we're coming from.
Obviously, this work isn't something that we alone can solve or the center can solve. We do it in partnerships. So talk about some of the important partnerships.
So Odessa Brown is one really great example. At Odessa, we get to partner with groups like the Medical Legal Partnership. One of the health disparities we have is like asthma. So sometimes I'll see a kid in clinic who lives in a rental apartment with their parents, and the parent may notice that there's some mold on the wall in the bathroom. And because they're in a unique position in that they're renting and they don't want to lose their housing, they feel kind of trapped, like there's nothing they can do. In those instances, I can call the Medical Legal Partnership and they can navigate. How do we talk to the landlord in a way that's respectful? We want their entire body and their entire family unit to be healthy. So we want to provide really wraparound services. We want to understand their education. We want to understand their nutrition. We want to understand their neighborhood, their streets, the safety. So we partner with those organizations to try and make sure that we can support families in every one of those places.
So thank you for the incredible work you do every day as a pediatrician, but more importantly as a leader as we continue our push to make sure that every kid has a chance to lead their healthiest life.
Thank you.
And cut.